Hey everyone, this is Dr. Jad, and today we're going over the MRCP PACES abdominal station. Watch this video till the end to get all the tips that allowed me to pass with just 11 days practice. We're going to be taking the tips from the first video in the series and applying them to the abdominal station. Before we continue, a quick disclaimer. I don't recommend leaving your exam preparation for the last 2 weeks. I just wasn't given a choice as I'd been put on the waiting list and I didn't think I would be given a slot. Now that's out of the way, here are my top tips. 1. Identify the most common stations. This is a really important first step. Once you identify the most common stations, you can prioritize your studying. Let's take a look here. 10 conditions account for around 90% of abdominal cases. These conditions are kidney transplant, chronic liver disease, hepatosplenomegaly, hepatomegaly, splenomegaly, liver transplant, polycystic kidney disease, ascites, inflammatory bowel disease, and abdominal mass. So if you learn these 10 conditions inside out, you're really stacking the odds in your favor. Of course, you want to study as many conditions well as you can, but it's great to be able to maximize your chance of success like this. Now that you know what to study, you also need to know how to study. This brings us on to number 2. Structure your studying. If you have a clear system, it will be much easier for you to recall crucial information during the exam, especially as you're going to be nervous. The structure I used was signs of disease, signs of severity, signs of etiology. This specific order lets you examine and present your cases in autopilot, as well as answer questions from the examiner effectively. So let's take chronic liver disease as an example. Some examples of signs include finger clubbing, leukonychia, Dupuytren's contracture, spider nevi, and gynecomastia. Signs of severity include signs of decompensated liver failure, which are encephalopathy, jaundice, and ascites. And the signs of etiology may include xanthelasma, indicating fatty liver disease or autoimmune conditions such as PBC, parotid swelling, indicating alcoholism, and discoloration of the skin, indicating hemochromatosis. These are only a few examples, but using this system will make remembering this information and getting into the right mindset so much easier. 3. The importance of a confident presentation. Remember, the examiner wants to know that you're competent, experienced, and a good communicator. I will give you an example of how to present a case, using chronic liver disease as an example. I examined this 50-year-old male who had leukonychia, spider nevi, gynecomastia, and shifting dullness on abdominal percussion, suggesting ascites. This is consistent with a diagnosis of chronic liver disease. Importantly, he was not jaundiced or encephalopathic, and his abdomen was not tender, making SBP as a complication less likely. There were no clear signs of an underlying etiology, but there are a wide range of possible diagnoses I would like to investigate for. This is a concise, well-structured presentation that paints a very clear clinical picture to the examiner, and this is what you will be expected to do on the day. There's no one way to do it, and the more studying and practice you do, the more comfortable you will become with your personal style. 4. Impress the examiner with knowledge beyond the curriculum. This will set you apart from the other candidates, although it's important to remember that you're not in direct competition with anybody. Just remember one fun fact per condition and you'll be fine. With chronic liver disease, if you're confident, you could try grading a patient vaguely on the Child-Pugh scale. This is a simple trick that can get you extra marks. 5. Anticipate the examiner's questions. The examiner will ask you to present your findings, discuss initial investigations and treatment, so you already know what sort of questions to prepare for, but you can give leading answers to fill up some of the questioning time with topics you know about. For example, with chronic liver disease, if appropriate, you can mention that you would manage ascites with fluid restriction, salt restriction, and diuretics. Your examiner would then likely ask you to name the recommended diuretics, which is easy. Of course, it's important to remember that your examiner will probably have some questions that they're going to want to ask you regardless, so this isn't a completely foolproof system. 6. See signs. As important as practicing with hospital patients is, it's just not that efficient. We've all spent hours trying to see 1 or 2 patients. You'll never get the exposure to all the signs and pathology this way. By picking the right online revision resources, you can make your revision so much more efficient. The 2 online resources I used were PassTest and Clinical Skills Pro. I personally think it's a good idea to use them both because the mixture of pathologies, presenting and questioning styles will make you dynamic enough to think on the spot and ace your exam. By not relying on one resource only, it makes you much better at thinking on the spot under exam pressure. I don't think I would have passed without using both Pass Test and Clinical Skills Pro, so I would recommend them both. Even though it costs more money to use both, you can use my discount codes in the description below to save money, and it's much cheaper than repeating the PACES exam, so I think it's a worthy investment. Now you know the secrets to acing your abdominal station. I hope this was useful. Please like and subscribe so you don't miss out on any tips on how to pass your PACES. Feel free to ask any questions in the comments section, and see you in the next video.